Hi, my name is Tim. I'm a nurse practitioner student here at Cedarville University, and tonight we're going to be performing a head-to-toe assessment, and we're going to start off with the general survey. This is Michelle. She is 53 years of age. She's alert. She's oriented ×4. Her prostate is erect. Her hygiene is good. No odor present. She has a pleasant affect about her, and we're going to move on to that head and face, and we're going to look at the skin first. We're looking for any lesions or scars, anything of that nature. I'm going to palpate the scalp, and while I'm palpating the scalp, we're looking for any bumps, lesions, and I'm feeling the hair. Look at how the hair is distributed throughout the head. Her hair is distributed evenly. The color is brown, and it's a medium texture. And now we're going to move on to we're going to palpate TMJ, the transmandibular joint. And can you open up for me? Close? Any pain?
No.
All right. And I'm going to palpate her sinuses. We're going to start with the frontal. Any pain?
No.
And the maxillary? Any pain?
No.
Okay. And from the head and face, we're now going to go to the eyes, ears, nose, mouth, throat, and neck. And we're going to start off with the eyes. We're looking at the eyes. The eyes are symmetrical. We're looking at the outer eyelids. They close appropriately. There's no gaps in them. The eyelashes are evenly distributed across. I'm going to pull your eyelids down a little bit. I'm looking at the conjunctiva. The conjunctiva is pink. The sclera is white. The cornea, iris, and pupil are symmetrical and with no opacities noted. And now we're going to perform, we're going to look at her pupils as they react to light. If you'll just look straight ahead. And we're going to do indirect and direct. We're going to do indirect first. Okay, now we're going to do direct. Okay, pupils reacted equally and to light, and now I'll take this follow my finger with accommodation, and from there we are now I'm going to do red reflexes with her. I'm going to look at I'm going to do a fundoscopy with her. We're going to do look at the red reflexes in the optic disc. Now I'm going to do my right eye is going to look at her right eye. We're going to come in at about 15-degree angle. Red reflex is present. And the optic disc was, the borders were well defined and no papillary edema present. Now I'm going to come to this side. I'm going to use my left eye for her left eye, and I'm going to do the same process. Red reflexes are present. And once again, the optic disc, the borders are well defined and present, and no papillary edema. Okay. And from the eyes, we're going to go to the ears. Just change my head out. And we're going to inspect the outer part of the ear, the pinna and the tragus. We're going to assess it for any pain or discomfort. None is present. We're going to put a specula on the scope. And we're going to look inside the ear canal. No erythema is present. The optic disc, no bulging. The optic disc was, not the optic disc, tympanic membrane was grayish and opaque in color, which is normal. We're going to come to this side. Same way, I'm going to assess the pinna and the tragus. Now we're going to go and we're going to inspect the canal. Same thing. No erythema is present. The tympanic membrane, the disc is, the tympanic membrane is grayish and opaque in color, which is normal. And from the ears, we're going to do hearing. And this is the Weber test. And this is going to check for hearing between the ears. See how?
Yes.
Okay. And now we're going to do the Renee test. And this, the bottom of this is going to be on the touch the mastoid bone. But we're going to do air.
Okay. Okay.
Okay.
Okay. Okay.
And that was the air was about 2 to 1 over the bone, which is how it should be. That's a normal finding. And the ears are complete. Now we're going to move on to the nose. We're going to look at the skin, make sure it's patent, make sure there's no deviation in the septum there, which there are none. So now we're going to change the speculum, put a new one on, and we're going to look inside the nose, inside each snare. You just tilt your head back just a little bit for me. Perfect. Okay. We're going to look inside this one. Okay. There was no, I saw the turbinates in both nares. No erythema was present, no edema, and no deviation in the septum. Okay, now from there we're going to move on down to the mouth and throat area. We're going to look at the outer structures first. At the lips are well symmetric. There's no cracking or splitting among them. And then we're going to open up. The buccal mucosa is pink and moist. Then we're going to look at the tongue. Tongue is symmetrical. The submucosa, there's no patches, no white spots, no patches present. We're looking at the teeth, and we're looking at the gingiva, and we're looking for cavities, and we're looking for gingivitis, and none are present. We also are looking at the soft palate. Soft palate is pink in color. And now we're going to look back in the pharynx at the hard palate and the tonsils. All right, perfect. Tonsils are grade +1, which is a normal finding. The hard palate was no erythema was back there. The tonsils had no erythema or exudate involved on it. And now we're going to move on to the neck. The neck, we're going to assess the carotid artery. And normally we would listen to the carotid artery with a bell on stethoscope. I do not own a bell on my stethoscope. Mine just comes with the diaphragm. It's a Littmann cardiology stethoscope. If you'll take a deep breath for me. Okay. Take a deep breath for me. And hold. Okay. Perfect. No bruise were appreciated. And now we are going to assess the lymph nodes. And we're going to start with the preauricle. And they should feel round and rubbery, small rubbery type nodes. And then we're going to the posterior auricle. Then the occipital. And then we're going to do the submandibular. Then the submental, then the anterior cervical, posterior cervical, then the supraclavicular. Alrighty. And then we're going to assess the thyroid gland now. I'm going to palpate first. And we're looking at the neck of the skin too. We're looking for any scarring, any breakage of the skin, or any lesions. None is present. Okay. If you will just take a swallow, but a sip of that, but don't swallow. Okay. If you'll tilt your head back just a little bit for me. Go ahead and swallow. Okay, the thyroid I felt moving up and down, and that's normal finding. Now we're going from the neck. We are going to move on to the cranial nerves, and we're going to start off with cranial nerve number 1, which is olfactory. And this I'm going to just demonstrate for you. If you close your eyes and close one of your nostrils for me, I would have 2 smells in 2 separate bowls, and like a peppermint and a lavender. And I would run one up under her nose, and she would smell it, and she would tell me what it was. Then we would do the other side, and then we'd do the other smell up under her nose and smell it. Okay? And that's cranial nerve number 1, olfactory. Now we're going to move to cranial nerve number 2, which is the optic nerve. And if you hold that out, cover one of your eyes, and read above the line above the red.
EDFCZP.
Change hands to the other eye.
EDFCZP.
Okay? And then both eyes.
EDFCZP.
Okay, she is 20/20, and that's optic cranial nerve number 2, which is optic. Now we're going to move on to cranial nerve number 3, which is ocular. Cranial nerve number 4, which is trochanter, and trochlear, and cranial nerve number 6, which is abducent. And I just want you to follow my finger with your eyes only. Perfect. We went through all fields, and she followed perfectly. That's good. So that's cranial nerve number 3, 4, and 6. Now we're going to go cranial nerve number 5, which is trigeminal. I'm going to place my fingers on her joint here, her transmandibular joint. Open your mouth. Clench your teeth. Okay? And I'm going to lightly touch her forehead in 2 spots. You feel that?
Yes.
And her cheek. You feel that?
Yes.
And her chin.
Yes.
You feel that? That's cranial nerve number 5. Now we're going to skip 6 because we already did 6. We're going to move on to cranial nerve number 7, which is facial nerve. And I want you to just do what I do. Smile, frown, puff your cheeks out, and squint your eyes tight. Perfect. And that's cranial nerve number 7, facial nerve. We're going to move cranial nerve number 8, which is the acoustic nerve. And I'm going to do the whisper test with her. I'm going to cover the other ear, and I'm going to whisper a number in her ear, and she's going to tell me what it is.
2.
Okay? And we're going to do the same for this side.
1.
Okay, perfect. And that was cranial nerve number 8. Now we're going to move cranial nerve number 9 and number 10 because they go together. Cranial nerve number 9 is the glossopharyngeal, and cranial nerve number 10 is the vagus nerve. And this will evaluate her soft palate and her voice. I just want you to open up and say ah. Do it one more time. Perfect. The soft palate moved appropriately, and voice was good. Okay, now we're going to move on to cranial nerve number 11, which is the spinal accessory muscle. I'm going to place my hand on your cheek, and you're going to push against it. Okay? Okay? And then I'm going to push my hand down, and you're going to raise your shoulders up. Perfect. And cranial nerve number 11, spinal accessory nerve, was intact. And now we're going to move to our very last one, cranial nerve number 12, which is the hypoglossal nerve. If you'll just stick your tongue out at me. Perfect. And now we're done with the cranial nerves. And now we're going to move on to the anterior chest. We're going to move on to breathe. We're going to look at it. I'm going to assess her breathing anteriorly. I'm going to use the ladder method. There are going to be 6 areas, 6 sets of areas that I'm going to move as I progress on down. It's going to be in a ladder motion. And 1, 2, 3, 4, 5, and 6, and 5, and 6. Okay. Lung sounds were clear to auscultation. Her respirations were even and unlabored. No stress noted. There was no adventitious lung sounds noted, such as wheezing rels or rhonchi. And now we're going to turn around. We're going to have her turn around on this table. And we're going to do posterior. We're going to assess her anterior and posterior. It's evenly symmetrical. It's a normal chest. It's not like a barrel chest or a pigeon chest or a funnel chest. And now we're going to check symmetry between her inhalation and exhalation. I'm going to place my hands right about the 9th and 10th rib. And you're going to exhale for me. Inhale and exhale. My hands moved up and down evenly. It's a symmetrical. And now we're going to, from there, I'm going to check for CVA tenderness. And that's a costovertebral angle. I'm going to place my hand, it's going to be right about where the kidneys are. I'm going to place my hand over, I'm going to tap it, and we're going to assess for pain on both sides.
No.
Okay. Now I'm going to listen to her lungs, and her lungs, there's going to be 7 areas using the ladder step method going down. Now I'm going to assess. That's 1. This is 2. This is 3. This is 4. This is 5. 6 and 7, 6 and 7. Once again, her lungs are clear to auscultation, and there's no respiratory distress noted, and no adventitious lung sounds such as crackles, wheezing, and rhonchi. Okay, if you'll turn around this way. Now I'm going to assess her. Chest. If you just lean forward, I'm going to assess her heart now, and normally I would assess her. There's 4 areas I'm going to assess. I would assess twice, one with a bell, but I do not have a bell, so I'll be using my diaphragm only. First area is going to be the aortic area, which is at the 2nd intercostal space, right sternal border. Then we're going to go to the pulmonic area, which is the 2nd intercostal space, left sternal border. Down to the tricuspid area, which is the 4th intercostal space, left sternal border. And then to the mitral area, which is the 5th intercostal space, midclavicular area. Okay? And the rhythm was a normal rhythm. It was a S1, S2. There was no adventitious sounds such as clicks, murmurs, or rubs, noted. Okay? And now from there, we're going to examine her upper extremities. We're going to examine the skin, the color. The color is appropriate for her race. The skin is intact, nothing broken, and we're going to, it's warm and dry. I'm going to feel her radial pulses, which is a regular rhythm, and a 2+ grade. And we're going to examine her. We're going to move down to her lower extremity. We're examining the skin. It's warm, it's dry. There's no edema present. It's all intact. And I'm going to feel her dorsalis pedis pulse. The rate is regular, and it's a 2+ rhythm, 2+ grade. And then I'm doing the posterior tibialis. The rate also is 2+ with a rate is 2+ with a regular rhythm. And now, if you would lie down on your left lateral decubitus position, and from here, I am going to assess her apical pulse, which would be at the about the 5th intercostal space midclavicular line, right about here. Perfect. If you lay to your back, then that apical pulse was a regular rhythm. If you pull your shirt up for me, and we're going to lower your down right there. That's perfect. Okay, and here I'm assessing the skin. We're going to look for bruising, bulging, any scars. None are present. Now I'm going to auscultate all 4 quadrants. I'm going to listen for vowel sounds. We're going to start off at the right upper. We're going to go to the left upper, left lower, right lower. Vowel sounds are present, and they were normal. I heard anywhere between 5 to 35 clicks or gurgles, which is a normal rate and rhythm. And now I am also now going to auscultate the arteries. I'm going to be listening for any grooves, and once again, I would use the bell of the stethoscope if I had one. And we're going to listen to the aortic arteries, the renal arteries, the iliac arteries, and the femoral arteries. So we're going to start off with the aorta. Then we're going to go to the renal. To the iliac. To the femoral. No buoys were appreciated. And now I'm going to percuss each quadrant, and I'm also going to percuss to find the lower border of the liver. We're going to start at the right upper, left lower, right lower, and that was normal. The normal sound I had was a timpani type of sound, which is normal. Now we're going to move to the liver, and if I'm looking for a dullness, okay, I found it right here. Okay, and that's going to be it. Now from there, we're going to lightly palpate the quadrants in the epigastric area, seeing if she has any pain.
No.
Epigastric area.
No.
Left upper.
No.
Left lower.
No.
Right lower.
No.
Okay, now we're going to deeply palpate, and we're looking for organomegaly, and we're going to start off in the liver area. And I'm going, when I palpate up deeply, I'm going to wait for her to inhale, and then I'm going to palpate deeply. Okay, and then I'm going to do the epigastric area. Okay, now I'm going to move over to the spleen area. Now I'm going to do the kidneys and the other kidney. Okay? And now I'm going to have her exhale. When she exhales, I'm going to try to hook my fingers up underneath her rib cage and feel the gallbladder. Okay? And no organomegaly was noted or present. And now I'm going to one last assessment. I'm going to check for rebound tenderness. I'm going to do McBurney's point, which is about 1/3 the distance between the iliac spine and the umbilicus, which would be right about here. Any discomfort?
No.
Okay, perfect. Okay, that ends the abdominal assessment. If you turn around. Next, we're going to do the neurological assessment and musculoskeletal assessment and deep tendon reflexes. We're going to start off with the neurological assessment first. I want you to take one finger, touch your nose, touch my finger. Okay? Now the other hand, do that. Okay? And just do it. Okay, that's for coordination. Okay, now I'm going to do, it's the same thing, so I'm just going to move my finger, okay? Just touch the finger as it moves. Okay? Very good. All right? That's coordination. And now we're going to, we're going to touch for feel now. And then I got a sharp object, and I got a soft object I'm going to use, and she's going to tell me what she feels. She's going to close her eyes.
Poke. Soft. Prick. Soft. Prick. Prick. Soft. Soft.
Okay? And if you'll take the heel of your foot, put it on your shin, and then go up and down, perfect, and do the other one. Ah, awesome, all right. And now we're going to do vibration. If you open your hands up like this.
Yes. Yes.
Okay.
Yes. Yes.
Okay. Vibration is present. And one last area for vibration, that would be the top of the feet.
Yes. Yes.
Okay. Now we're going to do deep tendon reflexes. We're going first to the tricep. You're just going to just let it go limp in my hand. And we're going to get this tendon right back here. We're going to use the flat part. We had contraction and we had extension of that arm. Same thing there, we had extension of that arm a little bit and we had contraction, okay? And now we're going to do the bicep. Just relax, just relax, just relax. Let me do it for you. Okay, I'm finding the tendon right there. And we're going to use the pointy part. Okay, and we had contraction of the bicep and we had flexion of the arm. Okay, same way with that arm too. Now we're going to go to the brachial radialis, and that's going to be about 3 to 4 centimeters, right about from the radius right here. Right about here. And we're going to use the pointy part. Okay, and we had contraction with some subluxation. Okay, same way with that. Now we're going down to the patella. Okay, we had contraction and extension of the leg. Same way we had a contraction of the quadricep, extension of the leg. Now we're going to the Achilles, and we're going dorsiflex the foot here. And we had flexion, plantar flexion on that foot. And we had plantar flexion on that foot, okay? And that finished the deep tendon reflexes. Now we're going to go to the musculoskeletal. I want you to walk normal, going over that way. Stop, turn around, and go back heel to toe. Perfect. If you just turn around and go back, and stop right there, turn around, face me. I want you to do what I do. I want you to look up at the ceiling, look down to the floor, put your head back normal, look to your right, look to your left. Take your ear and touch your shoulder, take your ear and touch your shoulder. Place your arms up in the air, bring it down to the goalpost. Scarecrow, bring your arms down to your side, bring them up 90 degrees. Raise your palms up, palms over, close fists, open them up, spread your hands apart. Okay. Okay? Put your hands down, take a turn around. Bend over a little bit for me. Right there, now we're going to check the scapula out for evenness. We're looking for scoliosis and kyphosis. There's none present. Stand up. Now we're going to turn over here. We're going to do the Romberg test. I want you to close your eyes. And this normally we would have her close her eyes for 20 to 30 seconds. But you can open your eyes, and if she doesn't sway or fall over, it's a normal test. And that concludes my assessment for tonight. Thank you.